Thank you. So I'm going to be, the objectives of the study that I'm going to be presenting today is to look at the knowledge of the abortion law among HIV-infected men and women in Nyanza, Kenya. We're also going to be presenting some results on their attitudes about abortion, as well as measuring the proportion of HIV-infected women and men in the sample who reported an unintended pregnancy or who had attempted abortion. We've heard a lot yesterday about sort of the geographical overlap between the HIV epidemic and high rates of or unmet need for family planning. But there's a similar overlap with areas of the world where there's high rates of unsafe abortion. There are approximately 6 million unsafe abortions annually in Africa, with most of them concentrated in sub-Saharan Africa, that lead to close to 30,000 deaths each year related to unsafe abortion, accounting for about 14% of maternal mortality in the region. And there's been a lot of evidence documenting the link between legal restriction to abortion and unsafe abortion and morbidity and mortality associated with unsafe abortion. For those of you who don't know, the 2010 Constitution of Kenya actually does allow for abortion in some instances. The new constitution explicitly permits abortion, according to Article 26, when, in the opinion of a trained health professional, there is need for emergency treatment or the life or health of the pregnant woman is in danger, or if permitted by any other written law. There's not been a lot written about or documenting how abortion might be perceived or possibly used by HIV-infected women in sub-Saharan Africa or Kenya. As part of the baseline research that some of which we talked about yesterday with our cluster randomized trial, we performed a qualitative study doing in-depth interviews with women and HIV-infected women in Nyanza on their fertility intentions. And although our interview guide did not specifically focus on unsafe abortion, this was spontaneously mentioned by quite a few participants, including the quote that's up there from one HIV-infected woman who had several children, who said, if she were faced with an unintended pregnancy, she said, I would contemplate abortion, but I would also fear that I would lose my life in the process of abortion. However, I would seriously consider terminating the pregnancy. So in terms of the methods of this study, these data were also collected in conjunction with the cluster randomized trial that I talked about yesterday, that was performed at 18 public sector HIV clinics in Nyanza. And as part of that, we conducted a cross-sectional survey in these clinics. Actually, it says subsequent. So it was at the end of the cluster randomized trial at the end of 2011, with close to 500 women and 500 men. And the questions I'm going to be presenting today focused on knowledge about abortion law in Kenya and attitudes about an experience with abortion and unintended pregnancy. We estimated proportions for the key variables and used multiple logistic regression models that also accounted for clustering in the study design. So the questions that focused on unintended pregnancy and abortion actually came from another survey instrument that was developed by the Guttmacher Institute and used in the study in Zambia and in Nigeria. The unintended pregnancy question was, women sometimes find themselves pregnant when they do not want to be, or when their situation makes it difficult for them to continue with their pregnancy because of their life circumstances or opposition from others. Have you ever been pregnant when you did not want to be? And for the abortion question, it was women sometimes take steps to end their pregnancy because they find themselves pregnant when they do not want to be, or when it is difficult for them to continue with their pregnancy because of opposition from others. Have you ever been in a situation where you or someone else have had to do something to end your pregnancy? And the questions were slightly modified for men. Demographics we talked about yesterday, it's the same sample from that survey. You could see that the majority of participants were 26 years old or over. The majority had primary education or less, and most were married, with more men reporting being married than women. This was a primarily rural sample, so about 80% of people said that they lived in a rural area. Most had disclosed their HIV status to their partner, and most said that they reported their health status as being good. You can also see that the vast majority had children. So in terms of the results of the knowledge of the abortion law, a small minority, so only 18%, sorry, you can see the y-axis only was up to 20% in this slide. Only 18% people who participated in the survey believed that abortion was legal for any reason in Kenya. Women are shown in red and men in blue. In terms of the reasons why they thought abortion was legal, of those who thought that they did, the most common reason is when the life of the mother is in danger. Fewer women thought it was legal, or fewer people thought it was legal when there was risk to the physical health of the mother, and even fewer thought it was legal when there was risk of mental health to the mother, and a very small percentage, about 1%, thought it was legal in cases of rape. We also asked questions about abortion-related attitudes, and in general, the attitudes were fairly negative in this population. The vast majority, almost all people, thought that the woman should discuss the possibility of ending a pregnancy with the man who was responsible for the pregnancy, which seems reasonable, perhaps. About 80% said that if a woman ends her pregnancy, she is avoiding duties as a mother. Similar proportion said if I knew a woman who ended her pregnancy, I would not respect her. And a very, very small proportion said a woman should be able to end a pregnancy if she wants to. I should say, though, that there was a question that was asked only of men, and 75% of men said that it is better for a woman to get an abortion than for her to carry a pregnancy to term that might be harmful to her health. In terms of unintended pregnancy, 38% of women and 23% of men reported an unintended pregnancy at some point in the past. And in the multivariable regression, you can see the covariates associated with unintended pregnancy. Not surprising, having more children was associated with unintended pregnancy. Also, reporting a fair health status, they had about twofold higher odds of having an unintended pregnancy compared to those who reported a good health status. And illiteracy, measured as not being able to read a newspaper, was associated with a lower risk of having an unintended pregnancy. So 8% of women and 4% of men in the sample reported having attempted abortion at some point in the past in this sample. Actually 6% of women said they had actually had an abortion in the past. And in multivariable analysis, the covariates that were associated with that were actually young age, aged 18 to 25, compared to women who were 35 or older, had a threefold higher odds of reporting having had an abortion. And similarly, having a secondary school education or greater had a threefold higher odds of having induced an abortion in the past compared to those with no education or primary education only. So in conclusion, I think this really highlights the low knowledge or low levels of knowledge about abortion law in Kenya. Although it's important to point out this was only done about a year after the Constitution had been approved. Similarly, stigmatizing views of abortion were very prevalent in this community. We found that unintended pregnancy was quite common, and about 8% of women reported having attempted an abortion in the past. So I think there's been a lot of talk about the importance of preventing unintended pregnancy, and that's certainly critical. I think as we start to think about the comprehensive services that HIV-infected individuals should be able to receive, we should also be thinking about counseling this population about the risks of unsafe abortion, and where possible, also referrals to services that provide safe and legal abortion services. Thanks.